Good afternoon. This is Judy Hackler, Executive Director for the Virginia Assisted Living Association, also known as VALA, and we welcome you here today for this afternoon's webinar called Social Security with You Through Life's Journey. And this is the VALA webinar just to provide a little more information for those that would like to know about Social Security. With us today, we have Jacqueline Weisgarber. She's a Public Affairs Specialist with the Social Security Administration. Jackie began her career with Social Security in 2006 as a claims specialist in the Charleston, South Carolina field office. In this role, Jackie served the public with compassion, courtesy, and respect and processed over 10,000 Social Security claims. In 2016, Jackie moved to Richmond after accepting the agent's Public Affairs Specialist position, where she implements Social Security's communications plans through local, regional, and national outreach initiatives. Jackie has received numerous agency awards, including a Public Service Award from the Social Security Commissioner, Andrew Saul. Jackie has a BA in journalism from the University of South Carolina and a Master's in Public Administration from the College of Charleston. For more information about Jackie, as well as Social Security resources, we invite you to also visit the website at www.ssa.gov. Again, that's www.ssa.gov. And with that, and to be mindful of your time, I turn it over to you, Jackie. Thank you for being here with us.
Thank you so much, Judy. And good afternoon, everyone. Thank you so much for participating in this Social Security seminar this afternoon. I hope this finds you and your families well, and I hope that you find this session informative. Next slide. Currently, as you may already know, Social Security field offices are closed to the public right now due to COVID-19. However, we are still open for business, and you can conduct business with Social Security online or via telephone. We want everyone to know what services are available during COVID-19, and you can find those detailed explanations of what we can do and what we can't do at the moment online at our website. We also want folks to be vigilant of scams and know that if there is any type of problem, that Social Security will mail you a letter. We will only contact you over the phone if you have requested a call or if you have ongoing business with us. So keep in mind, unfortunately, during this time, there are scammers out there trying to trick individuals. There are robocalls or live callers with scams and fraud, fraudsters pretending to be government employee and claiming that there is identity theft, when in reality, it's not the case. So just be very careful in how you communicate with an individual that may pretend to be from Social Security. We also want you to subscribe and be aware of the updates. If you go to our website, as Judy mentioned, ssa.gov, you can subscribe to updates and stay informed. So as we begin, next slide. When you think about Social Security, we really are with you through life's journey. You know, one of the first things a baby will receive in addition to their birth certificate is their Social Security card. And that number on the card will follow the individual through different life events, such as marriage or jobs, in other situations, unfortunate circumstances such as a disability or maybe losing a loved one. And really, retirement is what we're going to talk about this afternoon, which is obviously a kind of an exciting time, but there's lots to think about, including the future of Social Security. Next. When you think about Social Security, think of your taxes. Your employer collects a U.S. federal payroll tax, known as your FICA, or Federal Insurance Contribution Act withholdings. And those earnings are reported electronically. So this is how we track your earnings throughout your lifetime and how you earn Social Security retirement, disability, and survivor coverage for both you and your family members. So if you, for example, are working and you're building your Social Security by paying those FICA taxes, you should be checking your Social Security statement at least once a year. And many of you may recall that we used to mail that statement out, and we don't mail that out to every worker like we used to. We do mail it out to certain groups over age 60, but not everyone is getting that in the mail. So if you haven't already, I really encourage you to visit us online and register for your My Social Security account, where you can actually access that statement. And one other way to look at it is when you register for your My Social Security account, it ensures nobody tries to register for you. The account is safe and secure, and it's a great way to manage your Social Security record. Next slide. So we know a lot of workers will be paying into Social Security this year. Around 178 million workers are going to pay into the system this year. So around 94% of all workers are covered under Social Security. And what about those that are not covered under Social Security? Well, Virginia is unique because we have railroad, and we may see railroad retirees. That accounts for the 6%. Some of you may remember when federal employees prior to 1983 didn't have to pay Social Security taxes on their earnings. Those individuals were covered under a civil service retirement system. So that's also another example. Some teachers in certain jurisdictions across the country do not have to pay Social Security taxes on their earnings. So those groups account for the 6% not covered under Social Security. But again, most workers are covered under Social Security, so it's a very important piece when we talk about retirement planning. Next slide. Now, we would not miss the retirement party. So, we're much more than retirement benefits because we offer other tools for planning purposes, but keep in mind that this is a very personal decision, and you definitely need to know the rules because it will help you as you get to that, when you get to that point. Next slide. As of December of last year, over 45 million retired workers were getting almost $68 billion in Social Security benefits each month. And at the same time, over 3 million dependents of retired workers were receiving $2.4 billion in monthly Social Security benefits. So you can see how significant this is. When we talk about dependents, that could possibly be a spouse or a child, if a child's under age 18 in high school, or a child that was disabled before age 22. Next slide. Now, how do you actually qualify for Social Security retirement? To qualify, you have to work and earn those credits. So the credits are your building blocks of Social Security that we use to find out whether you have enough credits or earnings to qualify. So by earning those credits when you work and pay those taxes, you're building up your credits. In a nutshell, you need to work at least 10 years or have 40 credits. And one way to look at it is there's 4 quarters in a year. If you work 10 years, you've got your 40 credits. But each credit has a value attached to it. In 2020, this year, each $1,410 in earnings gives you 1 credit. So this year, to get all 4 credits, you have to earn at least $5,640. So if someone was shy, maybe a credit or 2, they may consider working a part-time job so that they could get those credits and qualify. Next slide. Now, we know what you need to qualify, but how do we actually determine what your benefit amount will be? So the credits are based on your total wages and self-employment income if it applies during the year. So what we do at Social Security is we take the highest 35 years of your earnings. Now, going back to the statement that I mentioned, when you look at that Social Security statement, it will show all of the years that you worked and the amounts you earned in those years. So we take the highest 35 years of your earnings and we bring it up to what it's worth in today's dollar. That's called indexing. So we can see both what you actually earned and what it's worth in today's dollar. When we add those high 35 years and we divide it by 420, that's the number of months in those years, we come up with an average index monthly earnings amount. Now, there is a formula that applies after this step. If you'd like to see that formula, it is on our website at ssa.gov. And basically, after we come up with the average index monthly amount, we break that amount into 3 different bend points. And once each of those bend points is calculated, that total amount added together is your estimated benefit amount. Now, in addition to the statement listed earnings, where it lists your earnings, it will also show you what your estimates for benefits will be at age 62, which is considered early retirement, at your full retirement age, and also delayed retirement age, which is age 70. That's the latest you will want to consider a retirement, Social Security retirement. Next slide. Now this slide shows, an illustration on age 62 up until age 70. And keep in mind, for retirement purposes, the best age to start receiving your Social Security benefits is a very personal decision. It's a very important decision. Financial experts say that you'll need 70 to 80% of your pre-retirement income to have a comfortable retirement. And with those that you serve, you probably see, a lot of folks managing their benefits well, or in some cases they may need more income. So it's really a personal decision. This illustration shows, however, at 62, again, which is the earliest point, keep in mind there is a reduction in benefit for filing early, okay, a reduction for age. So that reduction at 62 is 25%. But if you waited, the estimated amount goes up and the reduction isn't as high. At full retirement age, and this is for our illustration today, we're going to say full retirement age for our purpose is 66 because full retirement age is really based on your individual birthday. For someone born between 1943 and 1954, full retirement age is age 66. And you may have remembered back in the day, full retirement age used to be a flat 65, but that's no longer the case. So for anyone born after 54, but before 1960, their full retirement age may be between 66 and 67. And anyone born in 1960 or later, their full retirement age is 67. So very important to know when your full retirement age is if you're interested in filing and being entitled at full age. Next slide. And one of the questions we get is, can I work and receive my Social Security benefits? And the first thing that we recommend is that, again, you visit us online to search, and look at how work affects your benefits. So the rules are, if you're under full retirement age this year in 2020, you can receive your Social Security retirement benefit. Keep in mind that it is reduced for age and there's an earnings limit. This year, the limit is $18,240 a year. We call it the annual earnings test. So if you were to draw in under full age, that's your limit. And if you were to go over that, for every $2 earned over, we would hold back $1. Now, what's unique, however, is in the first year a person files for Social Security benefit, they may not become entitled in January 1, where there's 12 months in the year. Someone may retire in the middle of the year. So in the first year, if a person were to file under full age, they actually, we look at their earnings in a monthly view, and we don't penalize them for anything earned prior to that month. So we're able to kind of separate those earnings out in the first year. In the second column, the year full retirement age is reached is a little unique. As you can see on this slide, in the second column, you have a higher earnings amount that you can earn. It's $48,600 in the months leading up to the month of full retirement age. So let me just give you an example. Let's say Susan reaches her full retirement age July 2020, next month. She reaches 66 next month. So January through June of this year, the 6 months leading up to her birthday this year, she could technically earn $48,600 in those 6 months. So that may be where she may want to consider a January month of entitlement if she's going to be within that $48,600. Now, if not, and she went over that amount in those 6 months, for every $3 over, we would hold back $1. So we do have retirement estimators and calculators on our website, which allow an individual to do a month of election comparison, which is very helpful to give you a visual of, how much we would withhold if you were working while under full retirement age. And in the last column, the month that full retirement age is reached, at that point, if you were to wait till full retirement, the month of full retirement age, let's say in the same example, full retirement age for this individual is July 2020. Let's say it was July 15th, 2020. The person could elect the month of July. They could keep working. There's no earnings limit, and we wouldn't withhold any of their Social Security benefit. So one way to look at it is at full retirement age, full benefit, no withholdings, no penalties. Next slide. I mentioned the online calculators. We offer 11 different calculators to help you with your planning. So please visit our website to check out those calculators. When you visit our website, just be sure to scroll down near the bottom and click on the calculators button. Next slide. Now this is where it gets a little interesting, and I may share a few stories here when we talk about spouse benefits. And so a spouse who has not worked or who has low earnings can be entitled to as much as 50% of the retired worker's full benefit. So the way that looks is, let's say Bob and Sue married for 35 years and they're now at the retirement age. And let's say Bob was the higher wage earner and his full benefit amount, we call it the primary insurance amount. Let's say his full benefit amount is $2,000. Sue has worked, but maybe not as long or didn't have as high of earnings as her husband. So her benefit may be much lower. Let's say her benefit is $500. So you can see the difference. Half of Bob's, $1,000, is more than 100% of Sue's, $500. So in that example, Sue would qualify for spouse benefits. And the way that would work is Sue would file first on her own Social Security record and draw her retirement benefit, and then we would take an additional claim for her on Bob's record to bring her up to half. Now, if she's under full retirement age, she won't get exactly 50% because 50% is the maximum amount that the spouse could receive. Also, if she qualified for spouse benefits, it would not change her husband or the worker's benefit. It doesn't dip in to the worker's benefit. Again, this is why it's so helpful to look at that Social Security statement, because it also shows a family benefit. The family benefit is the total amount that could be payable on that worker's record. The last bullet on this slide shows that a benefit is unreduced if the spouse is caring for a child under the age of 16 or disabled. That would be considered a mother's benefit or a mother caring for a disabled child. Next slide. Benefits for divorced spouses, and this can be this is a unique topic, and it can really affect individuals depending on their marriage status. If a person is divorced, keep in mind that they may qualify, but again, there are rules similar to spouse benefits that are married. The difference here is that for a divorced spouse to qualify, one of the first things that Social Security will look at is duration of marriage. So the marriage must have lasted 10 years or longer. So if Sue contacts Social Security, let's say she was married to Bob for 25 years, she's not married at the time, she's 62 or older, and we know Bob qualifies for benefits, we're going to ask for the marriage and divorce decree to show that the marriage lasted at least 10 years. If the marriage was 9 years, 11 months, and 25 days, that will not meet the technical requirement of duration of marriage. So very, very important. Also, the benefit as a divorced spouse is equal to 50% of the ex-spouse's full benefit, okay? Keep in mind that a divorced spouse benefit does not dip in to the ex-spouse's benefit. If the ex-spouse, let's say Bob, if he's remarried, maybe he has other eligible dependents in his current marriage, the amount the ex-spouse may qualify for on his record will not change his family benefit. So that's very important. What we do need to verify, though, is that Bob is 62, and that he also is insured for his Social Security benefits. What's also unique for divorce spouse benefits is that the ex-spouse does not necessarily have to be drawing their Social Security benefit, unlike currently married spouse. So let me give you an example. Again, similar example, Bob and Sue were married, let's say 25 years, they're divorced, Bob remarries, maybe has a new wife, eligible dependents. Ex-spouse Sue has not remarried, she's over age 62, and we complete her application for benefits. In the application, we see that she's meeting the requirement, she's not working, or if she is, she's under the earnings limit. Well, if she's under her full retirement age. But Bob, he just has to be 62. He doesn't have to be actually drawing benefits, and that's called independently entitled divorced spouse benefits. So we just have to verify that Bob actually meets the requirement of age, and he's also insured for benefits. Next slide. Now, many of us have probably helped a loved one or in our community with the work that we do with survivors, helping them navigating the ropes as they go through this difficult time. We know that losing a loved one can be very emotional and financially difficult. So Social Security does provide a safety net to help if the unexpected happens. Many children, widows, and widowers may receive survivor benefits to help them cope with the financial loss. And again, when we think about Social Security, think about it as replacing income that is lost. I am replacing income that I'm losing because I'm retiring. Or if I'm a survivor, replacing income that I've lost when my husband passed away and could no longer provide that financial support. Next slide. The eligibility factors are pretty specific. For survivors, we are looking at if it's a child that they're under the age of 18 or in high school and not married. A child could qualify if they're in high school but no older than age 19. So if you know someone, maybe they had a parent that passed away with a child under age 18, that child would qualify for survivor Social Security benefits up until 18 or when they graduate from high school, whichever occurs first, or 19, excuse me, if they're still in high school. Also, disabled children. Many of us may know of a family that has a child that was disabled since birth. Maybe the child was receiving a needs-based benefit like SSI, and then when the parent actually filed for their retirement, we paid the child Social Security auxiliary child benefits in life. And then down the road, as the parent aged and maybe passed away, that now disabled adult child who may now be in their 50s or 60s themselves, they could be getting disabled child survivor benefits. And then the last category, which we oftentimes will think of for survivors, is a widow or widower, or even a divorced widow and widower. And remember, for divorced spouses, we do have a duration of marriage requirement of 10 years. Note that a survivor can get a full benefit if they are at full age, or a survivor could qualify as early as age 60. Now notice how that's 2 years earlier than early retirement. So very important. They may not want to file at 60 because it is a reduced benefit, but it is something they could qualify for if they were 60. And then age 50, if the survivor spouse was 50 and disabled within 7 years from the worker's passing, there is a category for surviving disabled spouse. And then the last area there for a spouse at any age of caring for a child, or for a child under 16 or disabled. Next slide. Now this illustration again shows kind of what I went over, but it's just kind of a different viewpoint. And I think this is really helpful because at full retirement age, remember, at full age, a survivor could get 100% of the deceased worker's full benefit or unreduced amount. Notice the second bullet, and I'll just use a quick example. I consider myself a wonderful neighbor. I moved to Richmond, Virginia in January of 2016. And after a few years, I moved out further into the country. I have wonderful neighbors. I love my community and I talk to my neighbors. And I share this because we all have relationships with friends and neighbors and family members. But let me share a quick story. Let's say Barbara contacts Social Security at age 62, and she's a widow. And she's been waiting for this day to file for survivor benefits. She's been looking to replace income that she's lost from her husband since he passed away several years ago. And she may have just a little bit of income and maybe a part-time job that just pays a few $100s a month. And so in talking with her, when she contacts Social Security and listening to her say these things, out of curiosity, I might ask her, well, Barbara, I'm just curious, is there a reason why you didn't contact us at 60? And it's not uncommon to hear, well, my neighbor told me it was 62. Well, I'm pretty sure that the neighbor had great intentions because she was thinking retirement and really probably trying to help explain what she thought was the correct rule for survivor benefits. But remember the difference, and this is so very important, that there are differences in the rules for life benefits compared to survivor benefits. The good news in this example for Barbara, however, is because she waited, her benefit amount will be higher, and she does lock in that higher amount. And remember, for survivors, the longer they wait, the higher the amount will be. The last bullet, claiming survivor benefits at any age between 60 and full retirement age is where a person will be if they're in this situation. Next slide. Other survivor benefits. There are other benefits available, such as a parent's benefit or a lump sum death payment. For parent benefits, this is an interesting category. It's for a parent who is age 62 and was receiving at least one half of his or her financial support from their son or daughter who died. So it's kind of like role reversal. There are not as many of these claims, but if you were taking care of your parent, listing them as a dependent on your taxes, maybe as a dependent parent, and providing their financial support, or at least one half of their financial support, if something happens to you, they could possibly draw Social Security on your record. The second bullet, some of us may have experience with helping individuals with the filing for the lump sum death payment. It is a one-time payment paid out to the surviving spouse living in the same household as the worker, or a child if there is no spouse, that a child that meets the eligibility requirement under 18 in high school or disabled. The lump sum death payment claim has to be submitted within 2 years from the individual's passing. Next slide. This illustration again shows the difference, spouse benefits in life compared to survivor benefits in death. Now, the worker and his or her spouse must be married for at least 1 year immediately before the day on which the application is filed. So just keep that in mind for spouse benefits. If the person was just married, 2 weeks, they may not qualify for spouse benefits. So there are some unique scenarios that we will need to look at depending on the person's situation. Next slide. One additional characteristic for survivors is that survivors can switch to their own retirement record as early as age 62 if their own benefit is higher than their survivor benefit. So maybe Sue started receiving survivor benefits at age 60 and Social Security sees that her own benefit exceeds that amount she's getting. We will send her a letter in the mail letting her know her own amount exceeds the survivor rate and to contact us if she would like to switch. She's not required to switch at that time because it may only be a few dollars more, but we do notify the individual. Sue may want to wait till a full retirement age or even delay it till 70 if it's that significant, but it is a choice, a very personal decision, and it can be a significant difference. So we want folks to know, to keep up with that and to let us know when they're ready to switch. Next slide. Representative payee. So this may really be pertinent for the folks that you work with or assist. Social Security's Representative Payee Program appoints a relative, a friend, or a third party in some instances to serve as a representative payee. And that person manages the individual's Social Security or SSI benefits. Now today, we're not really talking a lot about SSI, but I mentioned earlier that we do administer the Supplemental Security Income Program, which is a program based for individuals based on needs and financial need. So if a person got Social Security or SSI and they need help managing their benefits, we can appoint the rep payee. Keep in mind that a representative payee must know what the beneficiary's needs are so that they can decide what the best use of those funds are for their care and well-being. And this is especially important if the beneficiary isn't living with the payee. We really look closely at who is applying to be a representative payee to protect the interests of the individual. And we also have a representative payee portal, which is accessible through the representative's My Social Security account. So it allows them to conduct business or manage direct deposits, wage reporting if the individual is working, and other things as well. Next slide. Now this is really new, and it's really helpful for those that would like to designate a representative payee in advance. So just a few months ago in March of this year, we implemented a new option to help protect individuals' financial future. So the advanced designation of representative payee allows you or person to designate in advance up to 3 individuals who could serve as a representative payee for you should the need arise. So it is not an appointment of a payee nor a power of attorney. Just keep in mind that this is a voluntary participation and a person can update this as needed, but it's just a way for someone to tell Social Security in advance, down the road, if I needed this, these are the people that I would want to be my representative payee. Keep in mind that we only contact advanced designees if we determine that the person actually needs a representative payee. So that's helpful to know as well. Next slide. Switching gears, we're going to get into Medicare, and just keep in mind that Social Security helps individuals enroll in 2 parts of Medicare: the Part A, hospital insurance, and Part B, medical insurance. We do not manage the plan. The Center for Medicare Services administers Medicare and Medicaid, which is handled by the states. But we want folks to know what the enrollment period rules are so that they can enroll in their A and B during the proper enrollment period, because the enrollment is done through Social Security. And once the person is enrolled, Social Security sends that information to the CMS, Center for Medicare Services, so that they can administer and manage the billing and so on. Next slide. When we think about Medicare, oftentimes we're going to think of a person qualifying based on age 65, but there are other ways individuals can qualify. If you know someone that was getting Social Security disability benefits after 24 months on the 25th month, the person would be automatically enrolled in Part A and B based on disability. Lou Gehrig's disease, if a person has ALS, they will qualify for Medicare earlier based on their ALS condition. Kidney failure, if you know someone that may have had a kidney transplant or gets dialysis on a regular basis, those individuals may qualify for Medicare earlier. And then those exposed to environmental health hazards may also qualify. Next slide. Now, I mentioned the enrollment period rules. I'm just going to touch upon this. A lot of the folks that you may work with may already have Medicare, but this may be helpful for you personally. So keep in mind that there are 3 enrollment periods for Medicare: the initial enrollment period, the special enrollment period, and the general enrollment period. The initial enrollment period is a 7-month window, 3 months before your 65th birthday, the month of, and 3 months after. Okay, and that is when a person should look at to see if they need to enroll in both A and B. The special enrollment period is for folks that are 65 or older, that are working, or is married to someone that is working with covered group health insurance. So if I'm working and I'm married and I have my spouse and I covered under my group health plan, and I'm 65 and I plan to maybe keep working for another 3 or 4 years, I don't necessarily have to take the Part B because I'm under a special enrollment period, which basically says you can hold off on enrolling in the Part B. And that's because Part B does have a monthly premium cost, whereas Part A does not. If you've worked enough and paid enough into the Medicare system, Part A hospital insurance doesn't have a premium, whereas the Part B does. And this year, per person per month, that's about $144.60. So the person that's employed at 65 that has group health insurance, they may be able to wait to enroll when they actually stop working, and that's called a special enrollment period. The general enrollment period occurs once a year, January through March, once a year, and it's for those that didn't sign up for Medicare when they were first eligible. So that would have been in the initial enrollment period, or if they just did enroll in the special, if they had a special enrollment period. So keep in mind though, in the general enrollment period, they may have to pay a late enrollment penalty for as long as they've had Part B coverage. That's about a 10% premium penalty for each year that the person did not enroll, and that is a lifetime penalty. So you can imagine, let's say if someone was 65 and they should have enrolled in the initial enrollment period, but they didn't, and maybe they're now 70, they would have a 5-year premium penalty, and that could be a 50%, additional cost that they pay on top of the monthly premium of $144.60. Also note, as you probably know, Medicare premiums do go up typically a few dollars each year. Next slide. If you have questions about Medicare coverage, remember CMS, Center for Medicare Services, does handle that. We have some Medicare information on our website, but it's really CMS that manages all the ins and outs. If you're wanting to know why your bill has this cost or didn't cover this, you would contact CMS. We can also help folks apply for Medicare Part D extra help with their Part D prescription coverage. So if you know anyone that's maybe in a needs-based situation, they have very little income and they need some help paying their prescription premium, there is an extra help application on our website, and that can be completed online. We would look at their marital status, any income and assets that they have, to see if we can provide them with that extra help. Next slide. Medicare card, it's a red, white, and blue card. As of January of 2020, all Medicare beneficiaries should have received their updated card, which basically removed the Social Security number and has a special unique identification number on there. So if you know someone that never got their updated card, that may simply mean that we need to update their address, because Medicare referred to Social Security when they did the mailing for the updated card. So that can be updated through our My Social Security account or directly through Medicare as well. Next slide. I mentioned Social Security in the future. We're one of the most efficient agencies in the federal government. For each dollar that we receive, we spend less than 1 penny to manage our program. So, whether you're just starting your career or you're closer to retirement, it's important to understand that these programs are directly dependent on the availability of assets, the reserves in their respective trust funds to pay these benefits. So we know that two Social Security trust funds, the old age and survivors insurance and disability insurance, will be able to pay all benefits in full and on time until about 2035. So We have reached the brink of exhaustion in the past, but Congress has made substantial modifications. There have been changes. Some of you may remember some of the changes as part of the Bipartisan Budget Act of 2015 that did close some loopholes and filing strategies for spouses. And then some other changes like the maximum Social Security earnings amount limits, the earnings limits. Full retirement age has been pushed out. So those are just a few examples of changes. In the last bullet, we know that if Congress doesn't act before 2035, the trust fund could still be able to pay about 80% out in benefits. Next slide. Now, how does this work? If you're ready to retire, we encourage everyone to file for benefits online. Obviously, right now during COVID-19, our field offices are not open right now. We don't have a date on when they will reopen. So we want everyone to know how to conduct business with us. Online is the preferred method. You can call our 800 number. I'm going to mention this, and we'll get to this in a little bit, but because we're here with scams, do not trust that if you see this phone number, 800-772-1213, that's our number. If you call that number, you will reach Social Security, but don't trust that if you see that number on your caller ID that it's really us, unless you have a scheduled appointment or receive notice that you'll be getting a call from Social Security. And I say that because the scammers have gotten so good that they have spoofed our numbers, okay? So be very careful. But you can call us at our 800 number and make an appointment. We are completing telephone appointments for applications. But online, you can do the retirement, spouse, disability, Medicare applications. Unfortunately, at this time, we are unable to complete survivor claims online, so you would need to make an appointment for a survivor claim. And then the last bullet, at our office, and that's just at the time being, again, we are closed due to COVID-19. Next slide. This is what our website looks like. We looked at this earlier, but you'll see when you go to our website now at ssa.gov, you'll see the yellow banner addressing the COVID updates and then a red banner addressing the scams. Next slide. I mentioned My Social Security. It's really convenient, secure suite of services that puts you in control of your personal information. So I encourage you, again, if you don't already have that account, please register. One thing to note is you are unable to register someone else. Even if you have their written consent, you will not be able to sign up for someone else for My Social Security account, okay? Some other things here is if you've blocked your electronic access with your personal Social Security information, you may not be able to access the account. If you put a freeze on your credit report, you may not be able to access it, but there are some workarounds with that if it applies. Next slide. Scam awareness. Next slide. I mentioned this a little bit. Social Security, along with the Office of Inspector General, we continue to receive reports from across the country about fraudulent calls and people claiming to be from Social Security. They go to great lengths to trick people out of money, and this is not how Social Security employees operate. I'll tell you a quick story. In the city of Richmond, this was a couple months ago, actually before COVID, this was probably in February, I got a call from someone from the Richmond Sheriff's Department. They're working through a fraudulent case, and they had reached out asking Social Security some questions, and I got the call, and the representative left me a voice message. And I was out of the office, and my out of office said, I'll be out of the office, but I will call you back as soon as I return. So I returned about 4 days later, and I called the woman back. And when I called her back, she yelled at me and said, Social Security does not call members of the public. And she hung up on me. And I thought, oh my goodness. And about 5 minutes later, I got a call back, and it was the same woman with the Sheriff's Department. And she started laughing, and she said, did I just hang up on you? And I said, yes, you did, but I'm used to it. We understand. She had just gotten a fraudulent call, someone trying to scam her, and it was very fresh on her mind. So we understand that this is real. And if you are ever in doubt, hang up and give us a call, and we will help you through the issue. Next slide. Remember, we do sometimes contact citizens, but we will send them a letter. We do business, if it's an appointment, we would make an appointment and notify the individual in writing of the appointment time and day so they can expect the call. Again, if the person's ever in question of the call, please hang up and give us a call. Don't give out any information. We don't ever bring up gift cards or ask for random information. It's just not how we work. Next slide. Identity theft. Next slide. You know, it's one of the fastest growing crimes in America, and with individuals that are vulnerable, you know, unfortunately, they have gotten scammed. There were over 3.2 million reports of fraud, identity theft, and other reports to the FTC last year. And 1 out of 10 people lost money on imposter scams last year, which was over $660 million. So this is very significant. Next slide. These are some examples of what, you know, identity fraud misuse is on the left, and then the impacts of this to the individual. So if somebody were to open up a credit card in a person's name fraudulently, then that could mean a denial of credit card loans. You know, and we want people to be able to check their credit, you know, check their record every so often. I say this with the My Social Security account. If you have a My Social Security account, log in once or twice a year, maybe change your password every so often. Social Security will never ask you for your password. Okay, don't just give your password out. That is not what you should do. And if anything like that were ever to occur, make sure you change your password soon thereafter. Next slide. Now, we do keep your information safe and secure and confidential. Okay, so you know, you should not carry your Social Security card around. Individuals should keep that in a safe place and only bring it out when they're conducting official business. Also, when sharing the number, be careful about sharing the number. Maybe ask, why does the individual or organization need my number? Is it okay just to provide the last 4 numbers? Do I need to list all of them? So this does come up, and in some cases, we know groups do need the full number. So just be cautious and know, you know, the difference between, you know, why and why not. Next slide. If you were to have your number compromised, please call the company that, you know, where the fraud occurred, place a fraud alert on your credit report, and immediately report this to the FTC, the Federal Trade Commission. You can do that by going to identitytheft.gov. You can also contact your local police department. Next slide. This is just another illustration on how it works. You know, they're going to try to befriend you, ask you questions. You know, if you're actually being scammed, but on the identity theft side, it's our one-stop shop for identifying theft victims. So just keep in mind, this is where you can go at identitytheft.gov. There is free help. Next slide. There is free help if you're affected by fraud. There are ways that you can create a personal recovery plan, create an identity theft affidavit if it happens, and get a customized pre-filled letter where you'll be able to create and use that. You'll have your report and affidavit, proof of identity, and any other supporting documents to send to affected businesses such as credit bureaus or debt collectors if it applies. Next slide. There are things that we can do to help in terms of outreach and education. We're doing this presentation today to just remind folks of you know, being vigilant. We can help you get a replacement Social Security card. We cannot change a person's number. There are instances where if there is extensive misuse over a long period of time, where it is just really significant and severe, there are very rare instances where a person can get a new Social Security number. But most of the time, it is simply replacing the card and reminding the folks to keep it in a safe place. Next slide. There are things that we cannot do. We are unable to correct a credit record or file the theft report or act as an advocate, but we can refer you to the credit bureaus. Next slide. And these are 3: Equifax, Experian, and TransUnion. So these are the groups that you should contact if it applies. They do work independently. So remember, you know, if you fix your credit with one, it doesn't necessarily expunge the bad data from the other. Next slide. Other fraud resources are available here. And next slide, I will kind of wrap this up with just a plug for following Social Security on social media. We have a lot of information that we share. Sometimes we'll do live Facebook events with retirement information and seminars. We're on Instagram, YouTube. If anyone's looking for a job, we're also on LinkedIn, where we share available positions, and then also on Twitter, where you can follow us. And I noticed, Judy, I kind of went on, and I didn't go on any of the polls. Are we able to do any of the polls at this point?
Yes, we can do the polls.
Okay. I think they would still apply even at this point. If you want to add, it might be add some interaction here and get some questions sparked.
Sure. And also, I'd like to let everybody know that if you have a question at this point, you may also raise your hand and we can unmute your line so that you can offer your question, or you can also type it in the chat box. So the first poll is up. What best describes your position or role? Trying to figure out who's in our audience today. Still accepting answers. So it looks like about half of you are assisted living administrators. We also have a nurse or case manager or some other medical professional and the general public. After having learned what you saw today and heard today, I'd like to ask you, what age is full retirement age? Looks like many of you were paying attention. It's based on when you were born. It can be very confusing sometimes with the ages and what year you actually get to be eligible for the benefits. Jackie, would you like to say anything about this poll?
No, I think this is great. And I think the folks that probably answered 66 are probably born between 43 and 54. So this is, you know, the year, I guess, 2020. Many people born in that, 1954 will reach their full retirement age at some point this year. And then again, for those born after 1954, your full retirement age may be anywhere from 66 to 67. Now, one thing didn't really cover that I want to mention is a delayed retirement. If anybody's interested in what we call delayed retirement credits, it's about 8% interest each year that you delay after your full age. You could get that 8% interest. So potentially between 66, let's say if that's your full age, up until age 70, you could get 132% at 70 if you were to delay. Again, that is a personal decision, time or money. There's different ways to look at it, but full retirement age, full benefit, and then there is that delayed option. Some folks may want to delay only a year or may want to maximize the delay. So again, that information is available online.
Next poll, true or false? A surviving spouse, including surviving divorced spouse, can qualify for survivor benefits no earlier than age 62. Jackie, I'll let you speak to this one.
Thanks, Judy. And the answer is false. Remember, for survivors, it is different in life compared to death. A widower, or a divorced widower could get full benefits at full age or reduced benefits at age 60. Remember, so early retirement age is considered 62, but a survivor could potentially qualify as early as age 60. And again, we didn't talk about disability, but if disability was involved, it could be as early as age 50 if the survivor is disabled within 7 years from the spouse's passing. So very unique category. And remember, if you're affected as a survivor, just make sure you visit us online and look at those rules because they are different compared to life spouse benefits.
Next question, true or false? Centers for Medicare and Medicaid Services, also known as CMS, administers Medicare. Still collecting answers. Jackie.
Great, thank you. So the answer to this question is true. Social Security is going to help individuals apply for Medicare Parts A and B. And I also mentioned the extra help application for the Part D prescription program for those that may need help with their monthly prescription premium. But the Center for Medicare and Medicaid Services, CMS, does administer Medicare, and CMS is your main source for information regarding Medicare.
And the last polling question. Social Security's online services allows you to A, view your online statement, B, apply for benefits and check the status of your claim, C, request a Social Security and/or Medicare replacement card, or D, all of the above. The vote is unanimous on this one, that it's all of the above. And again, the online service is www.socialsecurity.gov as one of the options.
Very nice. I liked how we ended that, Judy. And I guess we can do, if it works, is open up questions if anyone wants to type one in.
Or you can raise your hand and we can allow you to talk verbally. Any questions or even comments? If you just want to share a comment, you may do that as well. Doesn't have to actually be a question. I have a question in the chat box. When you apply, how long does it take to get a payment?
Ooh, that's a really good question. And I thank you for that question. We suggest an individual contact Social Security 3 to 4 months prior to when they want to be entitled to benefits. So let's say it's retirement. If your plan, let's just say for example purposes, is to be entitled to Social Security retirement January of 2021, we can actually accept your application in October of 2020, okay? So October, November, December, it's about 3 months before we can accept the application. Now, once you're entitled, keep in mind that Social Security does pay 1 month behind, okay? And let me give you a couple examples. Let's first start with the age 62 example. Let's say you want to be entitled to Social Security the earliest month possible, age 62. Keep in mind, you would have to be 62 every day of the month to first qualify, okay? So if you turn 62 on January 15th, 2021, then February 2021 would be the first month you could be entitled. In addition, because we pay 1 month behind, February's payment would be made to you in March. And then to add to that, the day that a person is paid is determined based on where their birth date falls in the calendar month. So let's use the 15th for example purposes. If you're born on the 15th, your pay date is probably going to be the third Wednesday of the month. So February, in that example, February 15th would mean, January 15th birth date would mean entitled in February. February would be paid the third Wednesday in March. Now, you contact us 3 to 4 months, you complete your application, and let's say it's full retirement age. You want to be entitled, let's just say for example purposes, 66 is your full age, and that happens to be August of this year. If you elected August 2020 as your month of entitlement, August payment would be made in September. Okay, so you don't have to be full retirement age, every day of the month. If your full age is 66, the month that you reach full retirement age, you could choose, and then we would pay that month's benefit the next month. Okay. One other thing, and I don't know if this applies to anyone, but if someone was born on the 1st of the month, okay, let's say you turn 66 July 1st of 2020, we actually calculate your full retirement age the month before. So it would technically be June of 2020. So that's kind of unique if you're born on the 1st of the month. Did that answer your question? I think this was from Nancy. Did that answer your question?
We've also
Perfect.
received a comment from one of the attendees that this was an excellent presentation and very informative. So thank you
Oh,
very much, Jackie, for your information and for sharing it.
absolutely. Thank you. Really appreciate it. If there are any questions, maybe after the session, if they come up, feel free to reach out. I can give you my email address, which is my name. I'll just spell it. I'll do it phonetically. It's Jacqueline, JACQUELINE .Weisgarber, WEIS as in Sam, G as in George, A, R as in Roger, B as in boy, ER @ssa.gov. And if you do have a question and you send me an email, just make sure not to include any, personally identifiable information. You can share this scenario and I can give you a call. Also keep in mind, if you're calling on behalf of another individual, we have a lot of rules on disclosure and privacy, so I could speak in general terms, but if it's something very case specific, then I suggest that individual contact their local office. And again, going back to what I was saying earlier in the slide, we do actually have on our website right now, and this is due to COVID, we want folks to know how to contact their local offices. So if you go to our website and search for the office locator, you'll actually be able to plug in the zip code where the individual resides, and they can actually see the local office phone number and fax number. So if there's some communication that needs to happen with the local office, those local numbers are now available.
And I have also shared your email address in the chat box for anybody that is interested in the written spelling of it as well.
Perfect. Thank you so much.
Are there any other questions before we close out? We have a few more minutes before our scheduled end time. So again, we welcome any questions or comments with regards to today's topic. I am not seeing any come across or any hands raised, but I do want to thank you all for participating, and especially to Jackie for giving the presentation. Truly appreciate it. And if we as the association, Virginia Assisted Living Association, can assist any of you with regards to assisted living, please let me know. And I will also put my information in the chat box. And that way you can reach out to me. And then if you need to also reach Jackie, if you misplace her email address, you may also contact me and I can forward the information to you. So thank you all for participating, and I hope you all have a great evening.
Thank you, everyone. Thank you, Judy.